Hello friends, today we are going to discuss our medical discussion episode number 33. Today our topic is palpitation. Sir, my first question is what is palpitation and what are the causes?
So, palpitation, it is a very common diagnosis in our OPD. A lot number of people come to our OPD with the complaint that they can feel their heart rate, they can experience the heart rate in their chest, or they can feel heart palpitating, which they can feel even in their throat. So, this is what we mean by palpitation, that is feeling their own heart rate. So, palpitation can be caused by a number of factors. The most important factors are mainly physiological. It can be caused by a person having anxiety, depression, or severe stress. Moreover, it can also be caused by a normal exercise, running, walking, or if a person do any kind of vigorous activity, then he or she can feel palpitation. So, these are normal physiological things, but there are certain pathological or medical conditions in which a person can feel palpitation. One of that is that if a person has some medical problem like hyperthyroidism, where the thyroid hormones increases in their body, or if he is taking any medications which can increase their heart rate, it can also lead to palpitation. A person having certain problems of the heart, like if there is infection of the heart muscle, which we call as myocarditis, if there are problem in the heart valves, or if person is having heart attack or heart failure, then he can feel palpitation. Any kind of infection in the body, whether it can be urinary tract infection, whether it can be any infection in our blood, so it can also lead to palpitation. So there is a synchrony between the heart and the lung. So any problem in the lung itself also can lead to palpitation, like if there is infection in the lung like pneumonia, or if there is any problem in the oxygen carbon dioxide delivery or mismatch between the carbon dioxide and oxygen delivery in the lung, which can occur in asthma or COPD, it can also lead to the feeling of palpitation. So, there are a lot number of medical causes which can lead to palpitation, but most of the time palpitation is caused by mainly the physiological conditions, and among them anxiety, stress is very prominent.
Thank you, sir. So when a person should consult with doctor regarding this palpitation problem?
Normally palpitation we feel it in day-to-day life, but every time palpitation is not serious. For that we should see our heart rate. We can feel our pulse in the in our hand. So, and we can count it. Normally the heart rate should be between 60 to 100. This is known as the normal heart rate. If the heart rate increases to more than 100, we term it as tachycardia, and if the heart rate goes below 60, we term it as bradycardia. But every time tachycardia, it is not dangerous. We know that tachycardia can be caused by a lot number of physiological conditions, but the rate and rhythm should be determined. Rhythm means if we know that the heart is beating at a regular interval. However, if we feel that the heart rate is irregular, sometimes we feel that there is a skip beat, the heart is beating and suddenly there is a skip beat, the heart stops beating for a certain small amount of time and then it starts beating again. So, if the heart rate is irregular or irregularly irregular, then it can imply a serious problem. The heart rate, when it becomes irregularly irregular, then the synchrony between the various chambers of the heart, this is deranged. We know that there are 4 chambers in the heart, and each chamber is it is pumping at a synchrony with each other. So, if the heart rate is very high or if the heart rate is irregular, then the synchrony between these 4 chambers, it is lost, and therefore the pumping capacity of the heart, it decreases, and also the blood inside these chambers, it remains stagnant for a longer period of time. When the blood remains stagnant for a longer period, there is increased risk of clot formation within the heart chambers, and if there is clot, this clot can go from the heart to various organs of the body and cause a lot number of complications. If this clot goes to the brain, it can lead to stroke, it can lead to blindness if it goes to the eyes. In the lung, it can cause pulmonary embolism. In the kidney, it can lead to kidney failure. In the intestine, it can lead to intestinal ischemia. So it can cause a lot number of problems is if this clot is dislodged from the heart. So irregular heart rate is more dangerous. So rhythm is more important. Whenever a person feels irregular heart rate, he should immediately consult the doctor. Moreover, if the heart rate goes beyond 150, 180, 200, then it also imply a serious problem like PSVT or VT. So this type of heart rate, when it increases to a very high level, then the pumping capacity of the heart, it is compromised, and the person can land up in stroke, the person can have seizures, the person can have vertigo. The lowering of the heart rate, or if the heart rate decreases to a very low level like 40, 30, that is severe bradycardia, then this also implies a serious problem. It usually occurs when there is heart failure or any kind of problem in the sinus node. There is a node which gives the stimulation for the heart to beat. If there is problem in that sinus node, it can also lead to bradycardia or even tachycardia. So bradycardia or severe bradycardia is also very harmful because it can compromise the pumping capacity of the heart, and many of the organs are compromised because they don't get the necessary oxygen or the blood they require. So rate is important, but with that the rhythm is very important, or it is more important. If a person has very high rate or very low rate with irregular rhythm, then he should immediately consult the doctor.
Thank you, sir. Now we would like to know what are the diagnosis parameter and what are the treatment procedure of palpitation.
So whenever a person comes with palpitation, the most important test to be done is to look for the heart. First of all, we do an ECG. In the ECG, we know the rate, we know the rhythm of the heart, we know the various other abnormalities in the sinus node or the various in the electrical conduction system of the heart. So the ECG is important. However, if a person says that he feels palpitation occasionally, like in a week's time, or infrequently in a day, then we can go for a Halter monitoring. A Halter is a long ECG that records the heart rate and the rhythm throughout the 24-hour period. However, if the palpitation is more infrequent, then we can go for external loop recorders that records the heart rate for even a longer period of time, like month. Then next comes the echo, 2D echocardiography. Here this is an ultrasound of the heart where we see the various structural abnormalities of the heart, the valvular problems, if the heart can pump, the pumping capacity of the heart, the muscles of the heart. So we see the lot number of structural parameters of the heart in the echocardiography. Moreover, if we suspect any medical conditions like hyperthyroidism, like infections or any kind of lung problems, then we have to do the other tests to diagnose such problem. We should also see that a person is having any kind of infections in the blood or urine. So we should do a routine workup of the patient, not only to look for the heart, but also to exclude the other medical conditions which could cause palpitation. We should take a history of the patient, whether he is taking any medications that can increase the heart rate. If all these things are normal, if all the reports are normal, then we may think of depression or stress or anxiety that can lead to palpitation, and we can refer the patient to a psychiatrist or a psychological counselor. Now coming to the treatment, it depends on the diagnosis. If a person has irregular rhythm, we may need to give some anticoagulant or blood thinners that will decrease the coagulability of the heart, and he or she may need to take such medication for lifelong. Moreover, if the heart rate is too low, then he may need a pacemaker implantation to increase the heart rate. If there are any other medical conditions like hyperthyroidism, lung problems, infections, so treatment of such conditions will ultimately cure the palpitation. The most important thing is to look out for any kind of anxiety or stress disorders, and the person should go for relaxing techniques, relaxing exercises, yoga, meditation, etc., which can relieve him of the stress or anxiety, and ultimately it will lead to the cure of the palpitation.
Thank you, sir. Thank you for the wonderful discussion. We have learned so many things. So at last, what you would like to advise to the audience?
So palpitation, it is a very common diagnosis in the OPD. The physiological causes are more prominent. Moreover, the pathological or heart problems should be taken into consideration if the person has frequent palpitations, if the person has irregular heart rate, if a person feels irregular rhythm in the heart. So, if this type of problems should be sought immediately, diagnosis should be made immediately, and treatment should be done accordingly. I hope this video of palpitation is very useful to you all. Please like this video, share this video to all the near and dear ones, and subscribe our channel to motivate us to make such type of new videos. Thank you all.